good morning. My name is Penelope Barrera. I'm going to be your medical assistant today, and I'm going to show you how to properly don your PPE. So prior to this video, I made sure to wash my hands using proper techniques, scrubbing under my fingernails, also making sure to remove my jewelry. And I assembled my equipment, which would be my gown, my mask, my goggles / shield, my bouffant, and my shoe covers, as well as my gloves. So for the first step, I'm going to be putting on my bouffant, making sure to cover all of my hair, and putting all loose strands inside the cap. This is to protect the patient from any microorganisms that I may bring into the field, making sure not to contaminate their area. The next step would to be putting on the mask. As you can see, the mask has a blue side and a white side, as well as a metal bar that's at the top, which you should pinch at the bridge of your nose, pulling the ear loops behind each ear, and pulling the bottom of the mask under your chin. For the purpose of this video, I'm going to remove my mask so you can hear me more clearly, but the purpose of this mask is to protect myself from any bodily fluids that may splash onto myself from the patient, or as well as protecting the patient from any bodily fluids that may splash onto from myself to the patient, protecting both of us. After that, since I wear glasses, I would normally put on 2 shields, one on each side. This is to protect myself from any bodily fluids that may splash from the patient onto myself. Let it be noted that if you don't wear glasses, you wear regular goggles. The next step would be the gown. When you put on the gown, you have to make sure not to touch at any point the outside portion of the gown, making sure to pull your arm through, push your other arm through, and have someone tie the behind part for you. This is a 2-person job, so someone will always have to tie your back. This is because I want to protect the patient as well as protect myself from any bodily fluids that the patient may bring onto me. Once your gown is tied, making sure not to touch the outside, you have your shoe covers. Instead of bending over, you should bring your foot up, put your shoe inside the cover, making sure not to touch the outside of the gown once again. This is to protect the patient from me bringing any bodily fluids or microorganisms inside the patient's room. Lastly, I will be using proper technique to wash my hands fingertip to elbow and apply my gloves snugly over the cuff of my gown. And that completes my video. Thank you.